So, as the title said, I've officially been discharged from the hospital, well, for the physio on the wrist anyway. And I was discharged on the 12th of November, which marks 3 months and 2 days since the operation. So, uh, 2 months and 2 weeks since the cast was removed, if I remember right. So all in all, I had roughly 12 occupational therapy sessions or physiotherapy, whatever you want to call it. And I've had the go-ahead to do what I want, basically, no restrictions. So I've been back at the gym. This is my second week of gym going, back on the weights. Some sort of pain and stiffness, but nothing major. I'm basically doing the routine I used to do before the accident. So stuff like barbell bench press, dumbbell press, cable flies, push-ups, chin-ups, hammer curls, lower leg stuff, dumbbell rows, pull downs, reverse flies, row machine, shrugs, basically overhead press, all that kind of stuff. Now, bearing in mind that I last did a weight training session over 3 months ago, so the weight I'm lifting now is literally at most about 50% of what I used to do. That said, as this is only my second week back, I'm jumping up in strength pretty quickly. So, for example, I used to do like 80 kilos bench press, and last week I did 20 kilos, which is just the bar. This week I'm doing 30, so like the strength comes back quicker. If you've heard of muscle memory, you probably already know about that, where if you had muscle before and strength before, especially if you had it for a long time, it tends to come back quicker. When you lose it, like when you start retraining, it will come back quicker. You can still see there's a bit of an imbalance there, but I mean, I've lost a lot of shoulder strength and muscle, but at least I can start to like get it back now. So, yeah, there is still some stiffness, mainly doing twisty movements like this. And this is still not perfect, but the occupational therapist is pretty confident that that pain and stiffness will go away over time. She doesn't think it's the plate getting in the way of anything. She kind of like had a good feel around and like stretched it in different directions, and she couldn't feel anything impinging the wrist in any way. So I think it's just part of the recovery. I did break my ankle at the same time, and that's still quite stiff and sore in the mornings. So, and that didn't need any surgery on it. So if that's anything to go by, I think it is just like a waiting game. Just over time, things should get better. One thing I'm really happy I can do, not without any discomfort, but I can do press-ups again now. So I'll just cut in a quick video of me doing them at the gym. And as you can see, I'm struggling. I can do like 3 sets of 6 or 7 because all my chest muscles have just gone. I don't have the strength that I had, but it should come back. So finally, as this is the 3-month update, I'll just show you what the scars look like. The OT told me to carry on with the silicone strips for 6 months in total, so another 3 months. There's one of the scars. They tend to look redder when I've had the tape on them, so there's the other one. And finally I'll do the movements, so it's pretty straight and level. Supination. As you can see, the left one can hyperextend slightly, but it's neither here nor there. I think that's pronation. Pretty much bang on even. I can't remember what that one's called. Flexion, I think. That's still a little bit, although it's almost identical. That I'd say that's probably at about 95%, so almost there. Extension. This way is pretty equal, but going up this way, what's that called? Radial deviation. That's the one that I'm struggling with most. So, I mean, it's fine, but she said basically my left wrist can deviate more than average. So I think that's why I notice it more, because that to you probably looks normal, but to me there is a difference. This is a better way of showing it actually. So do you see that? I'll do it again. It's as high as I can get it. If I tan like that, you can see the angle difference. So yeah. So I'd say radial deviation is the only limited movement, and it may not improve anymore. As I said, I'd say that's at about maybe 60-70%. So not the end of the world. I mean, if that never gets any better, I think I can live with it. You know, it's not that important. But who knows? She said you can get improvements to your ROM for up to 12 months, so we'll see. But this one's definitely got better. That used to be more like up there. And she said at my last appointment, basically my last appointment was last week. Before that, it was 3 weeks prior. She said in 3 weeks, this movement had improved by 10 degrees, which is pretty decent. Likewise, my grip strength was about 20 kilos, and after 3 weeks, it shot up to 33, I think it is. So now I can just about squeeze this. It's difficult, but I can do it. It's still easier with the left hand, but I can actually start using this now because I've got enough strength to use it on the easiest setting. So that's a win. So yeah, my strength, grip strength, movement and all that should just continue to improve, especially now I'm back doing weight training 4 times a week. I've also started doing dumbbell wrist curls, so like arms flat doing this and then up like that and then up like that as well. So I'll show it again there. So yeah, that's essentially it. Hope all the advice I've given throughout this series has helped. I've definitely made a lot more progress than I thought I would in only 3 months, based on what I'd read on the Facebook groups and stuff. But I guess everyone recovers at a different rate. I think I've got age on my side, and like I'm generally quite fit and healthy anyway, so that probably, those two things probably went in my favor, because the break itself was horrendous. I've not really seen anyone break their wrist more severely than I did. But I guess a fracture is a fracture. It's like with my ankle, it's a hairline fracture, and the bone wasn't displaced, yet my ankle still hurts now. And, you know, there was no surgery done on it. So fractures are fractures and they take a while to heal. So yeah, I guess it doesn't really make that much difference. I think a lot of it also comes down to how good your surgeon is as well, how well they reset the bone, how well they realign everything, where they put the screws, where they put the plate, all that kind of stuff matters. In my case, 2 surgeons were working on my wrist and it still took 4.5 hours. So I was unconscious for close to 5 hours in total while 2 surgeons sliced me open and got it all realigned. I mean, you can see on the x-ray how good they realigned everything. So yeah, hope that helps. I'll do another update probably in 3 months time, so that'll be a 6-month update. There's no point me doing them every month, I don't think, because I've made probably like 90% of the progress I'm going to make. Anything in future is just going to be more about strengthening the wrist, and I'll give an update on how the scars look and feel, and if I get any more range of movement and if that tightness goes away over time. But that's, yeah, as I said, there's no point doing as regular updates as I have been doing. So yeah, cheers. Hope that helps.